What is a skull flap in brain tumor craniotomy surgery? Imagine needing to access the inside of the skull to remove a tumor. To do this safely, surgeons carefully cut out a section of the skull bone, called a skull flap. This flap acts like a removable window, giving them direct access to the brain tissue underneath. During a brain tumor craniotomy, the surgeon makes an incision in the scalp and uses special tools to create small holes called burr holes. These help guide the precise cutting of the skull. Once the bone is cut, the surgeon lifts the skull flap and sets it aside. The flap is kept sterile and protected during the procedure. It can be stored in different ways, such as under the skin of the abdomen or cryopreserved, that is, frozen, until it's time to put it back. After the tumor is removed and the necessary work is done, the surgeon replaces the skull flap and secures it with tiny titanium plates and screws. This helps the skull heal properly and keeps the brain protected. The use of a skull flap is a key part of most brain tumor surgeries because it allows surgeons to reach the tumor safely without permanently removing part of the skull. Sometimes, if there is significant brain swelling expected during surgery, the surgeon may choose to leave the skull flap off temporarily. This procedure is called a craniectomy. Later, once swelling has gone down, the skull can be reconstructed in a separate surgery called a cranioplasty, where either the original bone flap or a synthetic substitute is used. This technique helps balance the need for access to the brain with the importance of protecting the brain after surgery. It is a standard, well-established part of brain tumor removal surgeries. The process minimizes risks and supports healing by restoring the skull's protective structure. Always remember that each patient's situation is unique, and your healthcare team will tailor the approach to your specific needs. If you or a loved one are facing brain surgery, consult with your medical team for personalized information and guidance.